Hello, test 1, 2, 3.
Baik, kita mulai ya. Kejap, kita nak tengok ini. Okay. Already? Oke, baik. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Today is the last day. Not last day, tapi however, the day that we would like to give some report or progress for your industrial training, ya. For Nurin, SYUHADA, Muhaimin, Shahin, and FAQIHAH, and we have Federal Teaching Hospital from the mid of August till last of this week. Ya. Alhamdulillah, already attend some of we have Dean and other staff from PTH. For this presentation or report, each person should be before each person present each case. I would like to Nurin or present general activity during. Okay. Everyone's activity. Oh yeah, okay. Each person will present activity in this hospital. Oke, alhamdulillahirobbilalamin. Semuanya diberikan kesehatan, bisa hadir untuk acara laporan ya report last report untuk kegiatan magang di Rumah Sakit dan Pendidikan. Baik, setelah presentasi nanti akan ada sesi discussion ya, masing-masing case ya. Untuk tidak hanya case tapi setelah presentation nanti ada 1-2 question and nanti the last all presentation juga maybe need more discussion juga kita open. Baik, mungkin Prof. Denny mungkin ada yang mau disampaikan? Atau
lanjut aja Pak Ulum, saya mendengarkan.
Oke, baik. Terima kasih Prof. Baik, kita mulai. Urutannya macam mana ini? Sudah ada urutan siapa the first and the last host. Oke, baik. Jadi yang pertama siapa nih? Oh ya, oke, silahkan. Baik, mulai dari siapa tadi? Muhaimin. Yes, okay. Please start your presentation.
Hello. Yeah, okay. Assalamualaikum and selamat sejahtera. So today, my group and I are going to be presenting all of our activities that we've done throughout our 1 month of internship at Institut Pertanian Bogor. So a little bit intro on the Rumah Sakit Haiwan. Rumah Sakit Haiwan EPB is an animal hospital operated under Institut Pertanian Bogor, the university. And the animal hospital is managed by Faculty of Veterinary Medicine, Pertanian Bogor. And this animal hospital was established since 11 of October 2000. So next, we move on to the vision and mission of Rumah Sakit Haiwan EPB. So the vision is to become the selected specialist referral veterinary hospital and foremost, professional, independent, dignified, and serving the interest of and prosperity of the Indonesian nation. And its mission is to support veterinary professional education, specialist veterinary education, becoming a center for continuing education for veterinarians, along with research facilitation and service delivery, veterinary health to animals, society, and the environment. So next, before we arrived here, we were given a rotation schedule arranged by Doc Ulum, so that every week each of us are at our position at different stations with a different task every day for the whole week. So the first station that each of us will be faced will be the front office. So what the front office does is basically assisting in registration of patients, maintaining records, and also entering data, which is basically digitalizing all of the data that is on paper, and then to prepare surgical and boarding form for warded patient if the patient requires to be stayed overnight, and also liaising with staff and in other departments. So basically the flow is that when the patients and the pet owners come, they will arrive at the front desk and they will be asked to scan a barcode in order for the office to receive a digital copy of the pet information. And at the same time, they are required to write on a piece of paper, which is basically the physical form of the medical data. And this functions as a learning step for the interns and also the co-ed students, so that they can write down whatever they see by the patient, the condition, the clinical sign, and its temperature, body weight, heart rate, respiratory rate, basically all of the physical examination data. And once they're done with the front office, they'll be carried towards the polyclinic, which they will be then assessed by the doctor. And then once they're done with the doctor, they will come back to the front office with the patient form, which is called the rekam medik. With if they are prescribed medicine, they will be given a small white sheet, and from the front office, that small white sheet will be passed towards the apothec, where they will mix the medicine that is prescribed by the doctor. And once they have gotten their prescription, they will come back to the front office to prepare the payment for all of the facilities that they have received, including the treatments from the Rumah Sakit Haiwan. And that is all from the front office.
Okay, so now we'll be moving on to the consultation room. For that, my name is Muhammad Shahin, and I shall now be discussing on the consultation room part of the presentation. So as Muhaimin left us from front office, it's basically like a one-way flow in which from the front office, you will bring along the patient and its owner to the consultation room in order for us and the other co-ed students to perform physical examination upon the patients. So within the consultation room or the polyclinic in the poly, so there are cat consultation room, dogs consultation room, grooming room, and emergency consultation room. So there's 4 rooms in total in the consultation. Next. Okay, so here we have the pictures that we took for the polyclinic or consultation room. So what we, some of the activities we do, firstly is when we bring in the patient as well as the owner, what we will do perform physical examination. So what this physical examination includes is we will measure its body weight, we will check for its heart rate, temperature, and also respiratory rate, check for the mucous membrane color and the CRP, and as well as the hydration status. And so while we are performing such procedures as well, we can communicate with the owner and ask like several questions regarding the history, just so that we have a rough idea on what our differential diagnosis is for us as a learning process for ourselves before we went into the consultation room along with the doctor and listen to what the doctor has to say and compare to what we have. So in the consultation room itself, what we do is we mostly assist the attending veterinarian, the doctor, and such as restraining, preparing for drugs, injections, and as well as preparing other materials that are required for the procedure during the consultation itself. So as you can see, we restrain patients for medical procedures and as well blood sampling and placing IV catheters. And we are able to witness how the attending veterinarians perform their own examination and their own history taking. And this is as well act as a learning process for us as well. And also during our time here, we also use the polyclinic to practice several procedures such as blood sampling and administering IV port or IV catheter and establishing IV line as well, with the help of the paramedics here as well. So yeah, we also managed to practice thanks to the paramedics and the consultation. Okay, next. Okay, so we have the operation theater. There's a lot of operating theater here in the teaching hospital in Tibet. So most major and minor surgeries were conducted in the operation theatre. So there consists of large and small animals operating theatre. As you can see from the pictures taken here, are just from the one within the for the small animals, such as cats and dogs. So within the operating theatre itself, we have the aseptic operating theatre and as well as the non-aseptic operating theatre. So mostly for the aseptic, it's mostly for surgeries that includes like opening the abdominal cavity that requires minimal exposure to the environment. And also within the operating theatre itself, we have treatment ward and also to stabilize the patient. It's a recovery ward, sorry. And other than the pictures we also have the large animal operating theatre located at the back of the teaching hospital itself, and that's for the surgery procedures involving large animals. Next. Okay, so we have the ultrasound room located next to the polyclinic. So the main room equipment consists of ultrasound as well as electrocardiogram machine. So the ultrasound is basically used to produce image of internal body with sound wave beam. So some of the cases that we attended required ultrasonography, and most of the cases we are able to witness and also learn from Danny himself while he performing all this ultrasound on different cases as well. And we also managed to perform our own ultrasound on a research animal for us to learn as well with the help of Doc Nana. Yeah. Next. Thank you.
So moving on to the radiography room. So usually from the polyclinics, if it is required for the patient for its diagnostic workup to the radiograph. So usually the patient from the polyclinics will go to the radiography room to do X-ray of the patient. And usually here what we did was we practiced to restrain animal for the left lateral view, right lateral view, ventral dorsal view that is required as stated by the doctor there. So we did the X-ray here. So as you can see, here is the X-ray machine used, and also another room is for the X-ray interpretation room, and also there's also the clothes wear for the X-ray. Okay, moving on to pharmacy. Pharmacy is where the medication will be dispensed and also will be mixed, and also where the drugs will be stored here. So as you can see here for the first picture, this is the front desk of the pharmacy. This is where if there's any equipment or drugs used and needed by the polyclinics or by the doctors, usually we need to key in the data in which to know the flows of the drugs going out and into the pharmacy. So this is the front desk of the pharmacy. And then for the drug storage area, this is where most drugs and medical equipments are stored. All sort of the medication that is required by doctor can be found here. And also this on the picture, as you can see, this is the dispensing area. So this is where most medication will be dispensed and will be mixed because pharmacy is where the doctor's prescriptions will be received. So here, where the mixing and dispensing of medication will occur. Next. Okay, so this is the cat ward. So they have non-infectious and infectious cat ward. And as you can see here, the non-infectious cat ward. So usually patient that is not subjected to anti-infectious disease, patient will be placed here. And usually patient that will have upcoming surgery and the patient is not infectious, the patient will be placed here. And then we also have the cat ward for infectious disease. They have for infectious diseases for respiratory, gastrointestinal, and also for skin. So this is how good your biosecurity are. Okay, so also for dogs, they also have infectious wards for dogs. They have non-infectious and infectious one, but this one is the infectious one. So similar to cats, they have the infectious dog ward for the gastrointestinal system, skin, and the respiratory system. And
Okay, so now we move on to the non-infectious dog ward. So basically, the activity that the dog ward is located at the back of the hospital, and basically, the patient that have non-infectious disease are warded here. So we did the physical examination of the patient, in which we did the TPR of the patient, so the temperature, the respiratory rate, and also heart rate. And also we did the daily treatment, in which any medication that will be prescribed for the patient daily. And with the dogs that are awarded here also consists of the dogs from research for research animal. So next. So in the farm station, there basically pig farm, pig pens, the cattle pens, and also for goats. And for this part, we did the blood collection for pigs, in which we take the blood sample from the ear vein and also jugular vein. And we take blood from 7 pigs, in which the blood was taken for the research purpose and also to as the general checkup for the health condition of the pigs. And also there was one day where we observed the postmortem examination for a male interest pig, in which the pig was anesthetized, and also the blood was collected from the ear part of the pig. And also the pig in this farm was reared for research purpose. Next. So for the laboratory, there is 4 parts, in which they have the hematology analyzer and biochemistry analyzer, in which they will take the blood sample of the patient to check the complete blood count and also the serum biochemistry profile to diagnose the patient and also to plan for the treatment of the patient. And also there is cytological examination, in which they usually take the sample from the patient, and it is usually done for the tumor cases. And also there is also urinalysis for the patient.
Again, I'll be discussing about the additional activity that has been done on our internship here. And here is the additional activity, which is done at a flight surgeon course that is located at Jakarta. So when we arrive here, our first activity is we wanted to is weigh the rabbits. And after we weigh the rabbits, and we will mark them at their ear pinnae, and we will eventually marks their weights and marks their numbers, so that they won't have problem in the futures. And next is our activity is having anesthetic drugs calculations and administrations. First is we have to anesthetize these rabbits first before they undergo the surgery procedures. And also next we do is restraining the rabbits. So we restrain the rabbits during we wanted to administer the anesthetic drugs. And next is drugs administration that is done for the post-operative surgeries is going to be done through IM, intramuscular and subcutaneous route. Next is our additional activities is we handling the lab animal, which is mice. And the activity that conducted during the day is we restrain the mice. And after restrain mice, we will eventually administer the drugs through intraperitoneals for the anesthetize. And then after anesthetizing, we'll eventually do activities like blood collection and organ retrievals. So for the blood collection, the blood is collected through retroorbital sinus and also intracardiac. And for the organ retrieval, the organ that is retrieved from the mice for this research purpose is the liver. And another additional activity that we do here on our internship is assisting in continuous program development for ultrasound trainings for the veterinarians. So the activity that is conducted is the physical examination. The physical examination is where we will perform perform the physical examinations on the animals that are going to be used for the ultrasound. And the physical examination we do is we take the heart rate, we take the respiratory rate, we weight them, and then we perform the blood collection. So the blood collection is we wanted to see if the animals are in a normal conditions and if they are good to go for if they have to go undergo with anesthetic drugs. Next is restraining. Restraining is the restraining purpose is we wanted to restrict the movements of the animals, especially during the ultrasound procedure. And other activities that is being that we do during the day is we learn on how to perform the ultrasonographic technique. We learn how to detect and interpret the organs, the normal structures of the organ. And next is the knowledge and the training that we gain throughout our journey here in IPB. So first is we learn how to handle and restrain the pets animals and laboratory animals. The pets animals is the patients that came to the RSHP, and also the laboratory animals that we do is we learn how to handle, restrain the rabbits and the mice. For the blood collection technique is we do during our journey here is we learn how to collect the bloods from the pigs, from the dogs, from the cats, from the mice. And this technique is going to be crucial for us in the future. And another knowledge and training that we gain is ultrasound technique and interpretation. And this is we learn a lot on our journey is during our CPD, during the CPD training, and also during the daily checkup for the ultrasound. And next is the radiographic interpretation is where we learn how to positioning the animals on the tables, how to take the radiograph and how to interpret the radiograph. And next is we gain knowledge on improvements in client communication and how to deal with a client, how to explain to the client in a proper manner. And next is we also learn on how to perform the laboratory diagnostic. We gain knowledge and we train, especially when to do the blood work. And this is all I wanted to thank, and I wanted to give the credits to all of the professors, all the doctors, the staffs, the admins, and the co-hosts for helping us throughout our journey in here. And I want to give a big thank you for teaching us and take care of us as long as we are here. Thank you.
Okay, udah finish ya. Okay, thank you for your presentation. Okay, from audience, there are any question? Please raise your hand and directly talk. Bila tak boleh bahasa Inggris pun oke. Jadi boleh guna bahasa, tanya apa-apa, monggo silahkan. Ada soalan? Activity during this teaching hospital from...
Belum, saya komentar sedikit, belum.
Oke, monggo bro.
Sebentar ya, saya ini dulu cari Pak dulu. Baik, yang pertama saya ucapkan selamat kepada mahasiswa dari UMK yang sudah melaksanakan disebutnya apa? Apa industri ya? Disebutnya apa Pak Ulum? Apa industri tadi?
Industrial training.
Yeah, industry training.
Oke. Jadi selamat dan sudah melaksanakan itu. Kemudian saya melihat juga yang dipresentasikan kalian bisa mendapatkan banyak hal ya. Yang pertama tadi saya lihat salah satunya ada communication skill, improve itu sangat penting sebagai calon dokter hewan. Bagaimana kalian bisa berkomunikasi dengan baik, karena how to communicate itu sulit didapatkan di buku teks begitu ya, atau di jurnal. Kalian memang harus melihat langsung. Itu merupakan sangat penting karena bagaimana komunikasi itu nanti akan menjadi tahapan awal kalian berkomunikasi dengan klien, berinteraksi, mencari informasi terhadap klien, kemudian mencari informasi tentang penyakit hewan, itu sangat penting. Dan yang lebih penting nanti bagaimana mengkomunikasikan hasil pemeriksaan atau hasil yang sudah kalian dapatkan. Kemudian bagaimana menyampaikan juga hasil diagnosis, dan yang lebih penting menjelaskan prognosis hewan tersebut. Ya, menurut saya sangat penting. Kemudian yang kedua, kalian belajar juga berbagai teknik ya. Tadi ada blood sample collection, kemudian how to interpret radiografi, itu juga sangat penting. Dari data yang ada, pemeriksaan darah itu mungkin sekitar almost 50 to 60%. The doctor did the blood sample collection and do for the hematology test and extra dan juga blood chemistry test. Jadi almost sekitar 60% mengerjakan itu untuk mendiagnosis penyakit hewan. Jadi kalau kalian belajar itu tentu sangat baik. Sekitar 20 to 25 itu from the X-ray. Kemudian about mungkin sekarang agak increasing sedikit ya, 10 to 20% is using the ultrasound. Nah, jadi kalau kalian bisa menguasai itu dengan baik, mulai dari how to interpret the blood chemistry result test, hematology test, is sangat very valuable. Kemudian how to perform the X-ray and how to interpret juga sangat penting. Dan juga ultrasound, I think you are lucky because kalian dapat 2 kali CPD ya, 2 kali kesempatan CPD. Walaupun itu saya koreksi, sebetulnya CPD is not continuous program development, but continuing professional development. I think yang kalian tulis harus diperbaiki sedikit ya. Jadi CPD is continuing professional development. Kemudian, but the meaning is little bit, ya more or less the same. Tapi itu karena CPD itu the education or the activity yang dilakukan untuk mereka yang sudah bergelar dokter hewan. Jadi artinya dia memang yang sudah memiliki profesi dokter hewan. Kemudian apalagi tadi, rasanya itu semua masih banyak yang harus diimprove di our teaching hospital tentunya. Kemudian kemarin juga kita mendapatkan banyak masukan dari from the assessor from Europe, how we can to have a good laboratory practice, kemudian good isolation room practice. Itu kemarin dapat banyak masukan ya. Tentu harus terus diimprove lagi. The facility is good, but how to make the facility is running well and comply with the standard. Itu yang lebih penting lagi sebetulnya ya. Baik, kira-kira itu saja Pak Ulum yang bisa saya sampaikan. Sekali lagi selamat. Kalau dalam bahasa Indonesia ini mudah-mudahan paham juga, kalau ada sesuatu yang baik bisa disampaikan ke orang lain, kalau ada sesuatu yang buruk disampaikan ke kami untuk diperbaiki. Mudah-mudahan paham ya kalimat itu ya. Baik, itu yang bisa saya sampaikan. Sekali lagi selamat. Mudah-mudahan kalian nanti pulang ke Kelantan tidak ada kendala apa-apa, sehat semua, kemudian lulus nanti jadi dokter hewan dan berkontribusi kepada perkembangan veteriner di Malaysia khususnya. Demikian Pak Ulum, terima kasih. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Prof. Denny. Permit ya. Tanpa letter from BFKIN tak boleh datang ke sini. Oke, terima kasih. Special thanks for BFKIN and for tadi ya pesan-kesan dari beliau, mohon di fasilitas ya. Tadi yang CPD memang Content Professional Development ya. Kemudian dan beberapa fasilitas yang ada di hospital memang ada tapi optimalisasi. Kita baru open from pandemic, jadi start from 15 August ini baru full open. Jadi some part masih belum fully optimized gitu ya. Oke, mungkin dari yang lain siapa lagi di sini? Ada siapa nih? Mas Husni, ada yang mau disampaikan?
Pak Ulum.
Oke, Bro. Oke.
Kalau boleh satu-satu bicara masing-masing terus menyampaikan apa yang masih harus diperbaiki dari aktivitas ini gitu Pak Ulum. Kalau tadi kan kita mendengar dia baru aktivitasnya sama apa yang mereka dapatkan. Tapi yang lebih penting bagi kita kan the feedback. Feedback is most important thing I think. Jadi saya minta setiap orang bicara what is the feedback for us regarding this activity or the facility, etc. is apa saja boleh. Oke. Nanti bisa ditambah slide-nya Pak Ulum. Ya, nanti slide-nya bisa kita keep buat.
Oke, baik. Terima kasih. Siap, Prof. Baik, kita lanjutkan as request by Prof. Denny. Each person should be give any suggestion or recommendation for we have facility and activity for veterinary teaching hospital. So, boleh start mana-mana siapa? Each person ya. Oke, monggo. Siapa dulu? Ini mungkin boleh dipadam dulu share screen-nya supaya boleh kita tengok. Ayo Shahin. Shahin dulu, boleh.
Oke, assalamualaikum. Selamat pagi. Saya Shahin. Oke, ngomong bahasa aja. Jadi waktu kami di sini di rumah sakit hewan di IPB, karena kami itu dari UMK itu hanya klinik bukan rumah sakit hewan. Jadi di situ fasilitasnya lagi banyak di sini. Tapi kalau ditanya apa yang boleh diperbaiki gitu, saya ikut stationnya. Kalau front office itu mungkin in terms of like record keeping lah. A lot of itu buku-bukunya udah lama begitu. Nah, harus boleh di-update supaya lihat nampak lebih bagus gitu. Ya. Ya, and kalau and itu saja I think for like front office. Poliklinik as we can see dalam poli itu banyak fasilitas yang tidak digunakan. Macam di poli kan itu di dalamnya ada punya empty cabinet, tapi baru diletak sama pet food gitu. Jadi langsung kan kalau biasanya owner itu juga datang masuk ke poli juga. Jadi bisa itu promote gitulah item-itemnya, dan juga di facilities lihat juga ya tandas itu juga sudah dibersihin ya, and now the toilet is now usable lah. And also during our time here I think we could use a bit more tissue. Yeah, so because we feel like tissue is the best disposing like material to use to clean stuff, like sanitize stuff. So and usually waktu prosedur juga consultation, waktu mau guna tisu tisunya nggak ada, jadi harus dicari di consultation room sebelah gitu. Jadi kalau bisa harus di prepare siap-siap di setiap room itu sudah cukup itemnya, so nggak perlu like ke hulur ke hilir gitu. Langsung kalau in terms of surgery itu okay. rasanya sebab we able to like able to participate and assist in within the surgeries. And yeah, and also for lab, kalau buat lab itu mesinnya waktu rotasi lab saya harus diproses sampel 130 serum ikan. Jadi mesinnya satu. Jadi ambil masanya agak lama gitu. Jadi kalau bisa satu lagi mesin juga prosesnya juga masih lagi itu. Tapi mostly overall our experience di sini memang bagus lah. Good. We learn very much from the our time here, and also paramediknya di sini juga banyak membantu kami, di guide, tanya aja bisa dijawab ini kayak gini, ini kayak gitu. So dokternya juga sangat membantu, tanya apa soalan itu, dan mereka yang penting mereka everyone is so friendly. So yeah, that will make us miss IPB when we go back, the people here. Yeah, okay, thank you.
Baik, thank you Shahin. And the next who's?
Saya.
Ya, oke, Syuhada, jelas Syuhada.
Ya, saya campur-campur English sama bahasa ya. So basically in my experience doing practical here,
turn on your
saya
camera?
rasa macam
Boleh nyalakan
semua
kamera?
doktor dan staffnya sangat friendly. Ya. Enggak bah. Doktor dan staffnya sangat friendly dan
Kamera tak nyala ya. Ini pakai Nurin ya.
Ya.
Oke, silakan Syuhada.
Ya, doktor dan staffnya sangat friendly dan sangat membantu kami kalau kami nggak tahu di mana tempatnya, facility, and mostly Mbak Rahmi sangat ajar kami pasal praktikal. So sangat bagus sebab kami di universiti kami tak dapat peluang sangat untuk buat praktikal. Tapi dari untuk pembagian, saya rasa dari bab meracik ubat, which is it's consume a lot of time actually untuk campur semua ubat dalam satu kapsul. So maybe if there is another way, then better improve lah. I mean, that's all you could. And also maybe ada need to do pembahagian antara koas bila masuk consultation room sebab kadang-kadang terlalu crowded. And some of them tak dapat peluang untuk restrain atau handling animal sangat lah. So that's all from me.
Okay, that's all. Ada lagi?
Enggak ada.
Okay, who next after Syuhada? Siapa? Saya bergaduh lah.
Hi.
Ayo,
Okay,
FAQIHAH.
so my experience here has been like, saya campur ya bahasa Indo sama itu. Jadi my experience here is like been very very good and I learned a lot. Terutamanya kalau buat handling lab animal. Jadi itu satu experience yang very very good for me. And then so far semua orang itu kayak friendly banget and banyak for the improvements. I think everything is good. That's it. Thank you.
Yang ini yang apa? Should we need to improve, ada? Sure.
Semuanya bagus.
Okay, thank you. Yeah, and the next.
Hello, saya Nurin.
Oh, Nurin. Ya, silakan Nurin.
So first of all, saya mau bilang karena sangat membantu dan saya rasa saya belajar di sini sangat banyak and banyak practical and hands-on, dan saya percaya practical skills is the most important thing when you're a vet in future. Okay, so for improvement, okay, Sejujurnya facilities di hospital ini sangat bagus, sangat komplit, like semua benda ada gitu. Cuma improvement mungkin benda yang agak technical, like sangat kecil, kayak kalau apa yang saya kebiasaan, contoh kalau mau bagi obat, kami jarang langsung campur, kami selalu asing-asing. Tapi kalau di sini langsung campur aja kan. Itu oke aja, like oke aja kalau habis diguna, oke. Tapi kalau obatnya udah dicampur, kayak gak boleh guna ke patient seterusnya gitu kan. So like benda technical je. And then another improvement will be seperti teman saya bilang, Shahin, kayak setiap kali habis poliklinik kan selalu kita harus disinfect the polyclinic table, right? Kita selalu guna kain, just disinfect. But in our clinics, we prefer to use tissue so that we really fully disinfect and then we just throw the wipes. So we do not reuse the disinfect cloth. I think that's all. Bagus. IPB bagus.
Enough? Only that, Nurin? Okay, that's all. Okay, baik. And the last is silahkan. Ada Muhaimin. Okay.
Halo.
Waalaikumsalam.
Halo, Prof.
Kalau ulang slow ke? Kejap. Boleh dengar tak? Can you hear? Can you hear? Oh, okay. Kalau dari saya, overall saya dapat belajar banyak benda dari FIB juga. Tapi kalau dari segi improvement, mungkin macam kalau dari front office, kerana di klinik di Malaysia semua sudah guna digital. Macam di sini masih guna atas kertas, tapi dah mulai digital juga seperti guna Google Form. Tapi macam mungkin boleh guna satu sistem yang bila setiap doktor periksa haiwan, kemudian kalau dapat lihat macam clinical sign, kalau ada rashes atau fracture atau luka, boleh tangkap dan kemudian terus langsung upload. So kita tak payah guna handphone sendiri, HP sendiri, lepas tu kemudian kena hantar dekat semua orang. Tak apa tu, macam tunjuk, oh kucing ni ada kondisi ini, kondisi itu. Kerana menggunakan satu sistem online tu, terus langsung boleh upload. Kemudian kalau mahu refer, hanya minta nombor rekam medik saja, kemudian boleh lihat semua benda. Dia punya kondisi dia, apa tu, TPR dia, gambar patient sekali boleh lihat. Kemudian kalau another improvement mungkin sudah dibilang banyak kali oleh teman-teman saya, macam seperti penggunaan tisu tu. Guna kain sebab penyakit infeksi tak boleh hilang begitu saja, harus dilupuskan. So kalau guna tisu, pakai sekali, pakai buang terus. Kemudian kalau dari pembahagian tugas, mungkin seperti macam teman saya juga sudah bilang, SYUHADA cakap yang some station tu overcrowded sangat. Kemudian kalau tak ada tugas, kami langsung duduk di situ saja, tak buat apa-apa. Tapi selebihnya daripada itu, saya dapat belajar banyak juga lah, macam ditunjuk ajar oleh Ibu Rami macam mana nak ambil darah, pasang IV port. Kemudian hari tu dapat practice USG sendiri dekat Bigi, cari hatinya. Itu saja dari saya.
Okay, baik. Thank you for your apa ya? Di luar di sini anak-anak PKL, bro. Ya, di SMK dan ya penggunaan istirahat, dokter anak sedang pasien. Sang dokter TB. Silahkan, please your speak apa aja lah. Silakan. Sini dulu.
Terasa sudah sebulan. Ya, tidak terasa sudah sebulan. Sebenarnya kalau dari saya kan lebih banyak di Taman Kencana, jadi jarang melakukan diskusi langsung sama mahasiswa Malaysia. Tapi beberapa ada yang pernah ikut ke saya. Kalau saya standarnya harus sering sitologi kayak gitu. Terus nanti kalau seumpamanya sudah balik ke Malaysia yang baik-baik diturutin, kalau memang yang ada di permukaan yang aneh-aneh kayak kurang cocok cukup sampai di sini aja gitu, nggak usah dibawa keluar. Semua masukan-masukannya akan kami lakukan, terutama tadi yang kayak reuse lab itu sangat bagus caranya ya, benar. Jadi memang kita harus menggunakan tisu yang langsung dibuang gitu. Kalau kita pakai lagi, pasti akan ada yang nempel yang kita nggak tahu gitu.
Oke, kita sudah kasih komen masing-masing. Selanjutnya adalah kasus yang sudah yang nak guna buat apa namanya? Clinical conference. Oh, jadi last time ada macam mini seminar gitu ya? Nah, nanti outputnya macam mana? Itu di schedule for all student or?
Jadi setiap minggunya itu bakalan ada satu kumpulan 6 orang setiap minggu yang akan presentasi case kasusnya yang baik. Jadi kalau di sini kami itu kalau bisa itu dicari langsung kasusnya, soalnya itu langsung dibuka beberapa minggu setelah itu harus dipresentasi.
Itu satu angkutannya individu presentasinya untuk konferensi.
Buat audiensnya datang atau online nih?
Online juga ada.
Gimana?
Face-to-face. Oh, itu face-to-face.
Offline.
Nah, tapi punya audiens juga.
Maksudnya ada macam hall gitu, all student boleh attend and hear your presentation and discussion directly gitu ya?
Iya.
Oh, benar. Oke, baik. So, this session is macam praktis lah ya. Nanti selepas balik ke sana kan directly langsung present your lecture and your friends.
Balik sana masih diskusi sama supervisor.
Oke, jadi masih ada masa dalam 4-5 bulan ya. Prior to tadi juga.
3 bulan.
Satu bulan maksimum.
Presentasinya ikut giliran name list ini nomor 1.
Oh
iya.
Abdulnya nomor 1.
Itu apa next semester?
Iya.
Itu next semester.
Oke, boleh. Jadi we practice with your case that you obtain.
Masing-masing punya udah case ya?
Sudah ada, Bro. Jadi kemudian nanti dari kasus ini saya minta membuat satu paper collaborated author from SKHB and from UMK ya. Nanti dan fokus ke hasil data. Oke.
Itu bahasa Inggris kan mereka apa?
Yes. Oke, baik. Silahkan dimulai. Siapa dulu?
Ya, coba itu komunikasi secara
Oke, baik, silahkan. Who is SYUHADA? Oke, silahkan SYUHADA, present your case.
Hello, Assalamualaikum and good. Saya cakap English boleh kan? Boleh. Assalamualaikum and good morning everyone. So my name is SYUHADA Binti SALLEH and I will be presenting my case entitled coxofemoral luxation concurrent with patellar luxation in a 4 years old Pomeranian dog. So based on the client complaint, the owner noticed that the dog was limping on the right hand limb and reluctant to walk. So this is the patient signalement. So the patient name is Minnie, and it is a 4 years old female Pomeranian dog. Has body weight of 3.65 kg, and the vaccination and deworming status is nil, which is the owner didn't give any vaccination or deworming, and the dog is indoor dog and fed with kibbles. Next, so based on the history of the dog, on 28 August 2022, the owner noticed that the Minnie was limping on the right hand limb after playing in front of their house and exerted sign of pain during running. So after that, the next day, the owner brought Minnie to RSHP for medical visit. So this is the patient physical examination. So overall, the temperament of Minnie is bright alert responsive, and the body condition score is 3/5, and the temperature and respiratory rate is normal, but this patient has slightly high in the heart rate, tachycardic, and the dehydration status is good. And the mucous membrane color is pink. So based on the examination of the musculoskeletal system, Minnie exerts sign of pain in which it's vocalized loud during running. And there is non-weight bearing lameness of the right hand limb. And upon pulling on hind limb, the dog shows signs of pain also. So this is the video that we record during the medical visit. And as you can see that the dog unable to put its right hind limb on the floor and exert the non-weight bearing lameness. So this is the differential diagnosis. So the problem list is the dog exerts sign of pain during running, non-weight bearing lameness on the right hind limb, and also upon pulling on hind limb, the dog shows sign of pain. So for the differential diagnosis, I list out the luxation, hip dysplasia, arthritis, and also fracture. So the diagnostic workup done is only radiographic examination, which we take two views, lateral view and also ventral dorsal view. So based on the lateral view, from the right circle, you can see that there is craniodorsal displacement of the right femoral head. And also from the green circle, there is displacement of the left patella. So next, the based on the ventrodorsal view is also the same, whereas there is craniodorsal displacement of the right femoral head and also displacement of the left patella. So next. So based on our radiographical examination, we can roll out other differential diagnoses such as hip dysplasia, arthritis, and fracture. So based on the definitive diagnosis, it is coxofemoral luxation concurrent with patellar luxation. So the prognosis is good because the dog's vital parameters such as temperature, heart rate, and respiratory is considered normal. And also the only system affected is musculoskeletal system. And it's also, the prognosis is also good because the patellar luxation is only in grade one. And the coxofemoral luxation also is not severe that the dog is still able to stand properly. So for the take-home medication, the clinician gives vitamin D, 1/6 tab per oral, twice a day for 10 days to promote bone healing. And also there is meloxicam, which per oral twice a day also to reduce pain and inflammation of the bone. And also Oste also given 1/6 tab per oral twice a day, and which to promote bone healing also joint supplement. So for the client education, the owner need to keep the dog indoor and also limit the activity of the dog, because if the dog exert too much movement, it can actually exert too much force on the bone, which can worsen the condition of the dog. And also the owner need to comply with all take-home medication given in order so that the medication can affect the dog efficiently. And also the owner need to monitor progression of the hind limb and need to visit the veterinarian as soon as possible if the condition worse. And we need to schedule for follow-up and also sequential radiograph for 2 to 3 weeks interval. So for the future plan, if the condition of Mini is getting worse, we will suggest femoral head osteotomy, in which femoral head osteotomy is to reduce bone-to-bone contact, in which it can actually it can actually help the mobility of the bone. And also, the owner need to revisit for radiograph examination to reevaluate the condition of the bone to check for the bone healing progression. So that's all from me. Thank you.
Baik, thank you, SYUHADA. Maybe any question from audience about this cases or comment? Or paling saja.
Coba boleh lihat slide lagi. Yang terus. Oke. Boleh. Jadi kalau sebetulnya untuk saya pakai bahasa Indonesia nggak apa ya. Jadi untuk melihat jadi ada dua. Yang pertama melihat displacement dari kaput femoris itu. Yang pertama disebutnya oleh quality atau apa ya disebutnya subjective assessment. Jadi kita cuma melihat dari X-ray. Terus kalau yang another is more objective assessment. Objective using no break angle. Jadi how to calculate mungkin itu bisa coba dimasukkan di sini kalau misalnya itu lebih bagus. Jadi yang pertama dengan no break angle tulisannya MOHD itu pakai menggunakan Digimonitor aplikasinya. Digimonitor is a free application. Terus tapi the most important is that dia praktekkan is harusnya hewannya fully sedated atau yang karena kakinya harus terus tapi kalau akan ada gambarnya kita coba dihitung karena kalau no-break angle itu saya lupa kalau mungkin less than 105 itu dia sudah masuk ke so di upgrade from A to dari A sampai E ya kan terus kan nanti masuk ke saya itu bagus buat ditambahkan di nanti ya kan jadi ada kualitas itu. Oke, kemudian apa lagi ini terus cara hitungnya bisa tanya ke dokter senja dokter senja penelitiannya tentang itu assessment di anjing hitam. Oke, terus apa lagi next slide lagi. Oke, kita cari posisinya dokter list dan saya ini seksinya this lecture di boleh ya. Oke, next slide. Oke. Oke. Udah ya? Oke, itu aja tambahan.
Oke, baik. Tadi saya boleh kasih akses ke PCS ya. For KPRS, jadi nanti boleh adjust the image from your complete untuk melengkapi gambar-gambar kan semuanya sudah fix ya. Mungkin nak tengok more detail ini saya kasih 28 hari untuk macam ini dari situ kan, macam biasa gitu nanti kalian boleh explore more lah. Tapi ada sini ada. Oke, baik. After SYUHADA SYUHADA. Ini kalau supervisornya SYUHADA siapa? Prof Binti dengan Dr. siapa yo? Ayo, ini sudah mau siaman. Dokter? Oh, pasti belum kontak. Dokter siapa? Oh, oke. Okay, who next? Abdul. Abdul, silahkan.
Sekarang? Boleh dengar? Okay. So, Assalamualaikum and good morning. So, my name is Abdul Muhaimin Simunir. I'm going to be presenting a case on intervertebral disc disease and spondylosis in a 4-year-old French bulldog. So, the original client complaint is that the owner complained of sudden stiffness of their dog, OB, in the lower hind limbs. And then the owner came to Rumah Sakit Haiwan Pendidikan RSHP IPB for radiographic diagnosis and consultation because the owner has consulted with 5 separate veterinarians already. So including RSHP, this is her 6th. So for history, on July 5th, the owner noticed OB was suddenly stiff. It did not want to move. And then, but the owner did not do anything until the next day when OB, she observed that OB did not want to move. So the owner brought OB to a private practice, and then which claims that there was a fracture at the spine. So OB was given painkillers. And then on July 7th, OB slept while standing, meaning because OB couldn't move. So it was in a sitting position for a very long time. And then because of the sitting position, OB had a heat stroke. And then after that, the owner brought OB to the vet again, which then the vet suggested acupuncture. And then OB was prescribed another painkiller. The painkiller was not disclosed. And then throughout a whole month from July to August, the owner complied with the advice of the veterinarian from the previous private practice to go for acupuncture therapy 3 times a week. And then OB's condition improved in a way that OB can feel deep pain sensation, but OB was still unable to move its hind limb. So then OB was prescribed with Neurobion as a neuron supplement, and it was advised to stop with the painkillers. And then next we move on to the patient segment. So patient ID is OB. She is a canine French bulldog, 4 years old. Her body condition score is 2.5/5. Why is it 2.5/5? Because for a French bulldog, she's not, at 4 years old, she's not supposed to be weighing at 8.2 kg. It's supposed to be about 11 kg. And then for vaccination status and deworming status, she is up to date. And management, she's managed indoors because she can't move around anymore. And for physical examination, during the visit for temperament, OB was bright, alert, and responsive. Its temperature was 37.8. Her heart rate was 128 and respiratory rate was 48, which is quite high. So she was tachycardic and tachypneic. For musculoskeletal system, there was weight-bearing lameness of both hind limbs, and for urinary system, she has urinary incontinence. That is why she's wearing a diaper. And for neurological system, she's having hind limb paralysis. As you can see, her legs are splayed open like that. She is basically dragging herself when she's walking. And then next, for differential diagnosis from the problem list of sudden stiffness in the hind limb, weight-bearing lameness, and also unable to control the bladder, I wrote in IVDD, intervertebral disc disease, hind limb fracture, and spinal fracture. And then from the differential diagnosis, the diagnostic workup that is proposed would be radiograph and also myelogram. So this is the radiograph. The first radiograph is a left lateral view, focusing on the cervical vertebrae. Hold on. Focusing on the cervical vertebrae, we have there is spinal compression on the cervical vertebrae at in the red box, which is from T6 to T12. Sorry, it's actually thoracic vertebrae, not cervical. Cervical is in the neck. And then indicated by the red circle is alveolar pattern within the lung, and also indicated by the turquoise circle is tram lines, which is suggestive of bronchial pattern. So for the radiographical diagnosis, for the left image would be bronchitis, pneumonia, and also hemivertebrae. And for the right image, indicated by the dark purple arrow at the bottom, there is difference in opacity of the ischium comparing from the left and the right one. And then there's also a difference in the spinal conformation, which is indicated by the red box. And the spine is not straight. It's a bit deviated to the left side. And then there is also enlarged right ventricle and right atrium of the heart. So for radiographical diagnosis is hemivertebrae and also cardiomegaly. And then next would be a myelogram. This is just a zoom out picture of it. This is the zoom in, split into two. So for the first half of the myelogram, she is showing the irregular spinal cord conformation of the T6 to T12 by the red box. And then next, indicated by the yellow arrow, is irregular intervertebral disc conformation, meaning the vertebral disc is not even, it's a bit degenerating. And then on the right image is a zoom in picture of the pelvis, focusing on the os pelvis. There is a fracture indicated by the pink arrow. And then next is the left lateral view of the myelogram conducted. So with the myelogram, we can actually see the spinal cord. So over here is an overview focusing on the spinal cord compression due to the hemivertebrae at the T6 to T12. And then from the green arrow, which is the lumbar vertebrae, we can see intervertebral disc spur. At the pointer. There's no pointer. Wait. Oh, okay. So the disc spur is basically the intervertebral disc here. There's a bulging, compressing the spinal cord above that. 1, 2, 3. If not, it should be looking smoothly like this one. And then indicated by the blue arrow at the back is basically there is change in disc opacity, meaning the intervertebral disc has already mineralized. So from the radiograph conducted, I'm able to rule out hind limb fracture and also spinal fracture because the spine appears to be normal. The only problem that can be seen is the intervertebral disc. So with that, I came down to a tentative diagnosis of intervertebral disc disease and also spondylosis. Why? Because actually French Bulldog is a breed that is predisposed to IVDD and also spondylosis due to its size being a chondrodystrophic breed. And also the most common type of IVDD that this chondrodystrophic breed would be predisposed to is Hansen type 1, meaning wear and tear of, and also calcification can damage the disc over time, and also rough activities such as jumping and also vigorous exercise can overwork their spine and cause their intervertebral disc to be in part with a lot of pressure. So for the prognosis, I put fair. It's because the dog is able to get back few of its original function of its hind limb, which is only the pain sensation. It's not the full functionality. So from the initial visit to the doctor, and their recommendation was to go with acupuncture and water therapy. So Obi got to gain her pain sensation back because before that, Obi could not feel anything in the hind limb. And then after all of the alternative efforts that has been advised, the only suggestive way that Obi could potentially gain her full recovery is through surgical intervention. So with that, the client education as of this consultation will be to continue with physiotherapy such as acupuncture and swimming, put OB in cage rest and monitor the weight, because if OB is overweight, it will impart more weight and pressure on the hind limb, and it will cause the muscle in the hind limb to atrophy. And also what the owner can do is to do slow manipulation of the joints to relax the stiff muscles, and also gentle kneading of the muscle. Kneading is like massaging the muscle so that it can promote improve the blood circulation towards the hind limb. And then for future plan, OB is actually scheduled for hemilaminectomy, and after the hemilaminectomy, another future plan that can be implanted is to repeat the radiograph and also the myelogram post-operation. So what hemilaminectomy is basically it will relieve the pressure that is being put upon the spinal cord, which is causing the neurological dysfunction of the hind limb. And that is all from me. I would like to give credit to Dr. Nana for consulting this dog, and Mas Zaldo for providing the radiograph, all the staff at Rumah Sakit Hewan IPB, and also my friends that attended this case with me. Thank you. Tak, dari klinik sebelum dia hanya datang.
Dari film yang sebelumnya.
Ini kan dari mana? Anugerah 1. Oke, saya boleh komen ya. Case-nya juga bagus. Dari halaman 1 tuh. Oh ini 1. Oke. Oke. Ini plan konkretnya. Oke.
Obatnya tidak diberitahu.
Oh, obat-obatnya.
Hanya disebut painkiller yang lain.
Kalau painkiller apa kalau buat anjing?
Oh, jika sakit.
Selain paracetamol apa lain? Oke, di ada lagi. Kalau yang sering ada saya obat coba kalian browsing Rimadil. Tidak pernah dengar Rimadil? Bukan Tramadol,
Rimadil.
Ya, Rimadil. Apa isinya? Ibuprofen, ketoprofen, terus mau painkiller dan dia non-steroid. Dan hampir semua hewan-hewan kalau Binti itu pasti kalau kena pain itu semua pakai protein, dia non-steroid, boleh long-term apa hanya short-term? Boleh long-term. Karena kalau yang steroid kan tidak boleh long-term ya, karena menyebabkan apa? Reduce immunity. Dia suppress D. Ya, suppress immunity. Kemudian kalau tramadol itu kan nggak boleh sampai cuma itu. Oke, lanjut lagi berikutnya. Oke, lanjut lagi. Oke.
Kalau saya mau in tadi boleh. Balik ke jam kaki di keyboard.
Buat dia dari
Yes.
Boleh. Yang parameter B itu kenapa tidak dimasukkan di differential analysis?
Dan itu dapat tahu selepas.
Oh, ini before ini. Oh, oke. Baik. Next lagi. Oke. Oke. Ini gambarnya dari sana. Kalau gambar X-ray, gambar X-ray left side should be on the right side of the interpreter. Jadi kamu harus tentukan gambar itu.
Oh, yang
kiri. Nah, ini soalnya. Nah, ini oke. Nah, ini oke. Ini oke. Yang next. Nah, ini sudah kiri. Kan itu left side kan? So left should be on the right side of the interpreter. Jadi harus diklik. Semua gambar harus kalian cari buku teks radiografi semua left side of the hasil X-ray itu sudah di right side. Jadi kan left side itu sebenarnya sini L, so L sudah di right. Ini kemudian ini oke. Tapi sebenarnya dari gambar ini ada organ lain yang lain juga sebetulnya yang besar apa? Ya, liver. Jadi kamu tambahkan aja.
Nanti prosesnya di belakang
Nggak apa-apa. Terus coba kalian bisa lihat juga itu kan lambungnya di sana.
Ya, ada gas.
Ada gas kan? So, mundur lagi coba kan. Ini juga sama kan ada gas kan di sana. Nah itu wallnya tebal itu dindingnya. Dinding. Kelihatan kan? Nah, itu juga kalian tambahkan ini. Lipanya juga besar ya. Spleen mana spleen? Spleen. Itu oke. Itu spleen ya. Nah, hewan ini kan udah dikasih obat painkiller cukup lama ya? Lama nggak kan?
Lama kan. Dari Juli. Tapi dihentikan bulan 8.
Bulan 8. Karena kalau lihat dari lambung, itu kan dindingnya tebal. Mungkin dia ada peradangan pada lambungnya karena terlalu lama obat painkiller. Jadi kalau mau dikasih juga buat lambungnya atau dikasih terus itu kan ini ada kilogramnya ya. Jadi tadi compressionnya di berapa aja?
Compression di ini spinal cord compression.
Kalau hitung dari depan dari belakang?
Dari depan.
Dari belakang lebih enak 7, 6, 5, 4, 3, 2, 1. Tidak akan salah kan? Coba hitung dari belakang 7 kan? Betul nggak? Kalau hitung yang dari depan? Itu second pasti kan?
3, 2, 1. 3, 1.
Ya. Berikutnya lagi. Nah.
Ini bisa jadi definitif terus.
Udah ya sudah boleh, jangan kreatif lagi kan. Nah, kamu masukkan di sini yang tadi yang kita beri.
Oh.
Karena kan udah dari itu kan. Terus berikutnya lagi. Donasi sampai terus. Application, apply. Terus mungkin boleh ditambahkan itu suggest treatment, ya kan? Suggest treatment untuk at least to reduce the pain. Oke. Azmi.
Ini Prof.
Akhirnya ada yang kebetulan hari ini nggak ada apa-apa ya. Saya lihat itu saya kosong. Istirahat. Simpan di
Oke, baik. Terima kasih, Abdul. And the next host? Siapa? Oh ya, Shahin, silakan.
Okay.
Udah. Tidak aja nih sekalian dengerin. Kayaknya mereka perlu diajarin Nordic English. Oh, boleh dong.
Iya, oke, boleh dengar. Udah. Halo, halo. Tes, tes, tes. Ada? Ada? Oke. Start? Oke. Okay, Assalamualaikum warahmatullahi wabarakatuh, and selamat pagi. Nama saya Shahin, and I shall be presenting on my case that I've attended, which is suspected hypertrophic cardiomyopathy, HCM, who carried with heat stroke in a 7-year-old beagle. So ini patient ID-nya Panda. Panda is a canine beagle. She is 7-year-old. She's a female intact. Her body condition score is 4 out of 5. Agak gemuk. Weight-nya 15 kg. Vaccination status nil. Deworming status nil. And managed semi-romal fed with wet food and kibbles. So, ada. Electric. Okay. So, client complaint. Owner mentioned that Panda has been having heart and respiratory problem consistently through the years. Apa ini? Okay. Recently, the owner left for a vacation and left the dog alone within the household. Once they've returned, the dog shows signs of rapid breathing, fever, and depression. Panda has reduced appetite. So next. Tak keluar. Yeah. Okay. On the 21st August, once the owner returned from their vacation, owner noticed that Panda is having difficulty in breathing, hyperventilate, fever, and also shows signs of depression. So the next day, owner brought Panda to clinic Taman Kencana and was given bronchodilators and antidiuretic. And the clinic asked the owner to refer to Rumah Sakit Haiwan IPB for further radiographic analysis. So on the same day, 22nd August 2022, the owner brought Panda to IPB, Rumah Sakit Haiwan, for a radiograph. Next. So, okay. This is the physical examination that was done for Panda. So the vital signs, the temperature was 40.1 degrees Celsius, which is above the average normal. Panda is having fever, so pulse rate is normal, and the respiratory rate is 104 breath per minute, which is very high due to it's having shallow rapid breathing. Okay. So the temperament, Panda appears depressed, and the mucous membrane was reddish blue, as it appears slightly cyanotic. The CRT was 3 seconds, and the dehydration was estimated about 8%. we are not because Panda came in as in like an emergency case, we weren't able to perform much of physical examination, but the oral cavity was examined to be within the oral cavity, the tongue appears to be cyanotic in color, which shows that Panda is having hypoxia. Got a video. Mana sih? Ini bisa di play nggak? Bentar. Ya. Boleh kan? Ya. Ada suara kok. Ada suara, tak ada. Okay, so basically this video is just to show the rapid breathing from Panda. So Panda shows hyperventilation throughout our assessment. Oh, ini ada. Enggak apa-apa sih. Yeah, so basically this video is just to show that the Panda is having hyperventilation. Sorry for the video is not loading. Okay, it's okay. Okay, here. Itu. Yeah. This right here, she was placed in the nebulizer and oxygen chamber within the polyclinic. Okay, so here is our problem list. We have rapid and labored breathing, fever, lethargy, and cyanosis. So the differential diagnosis that I've came up with is hypertrophic cardiomyopathy, HCM, myxomatous mitral valve disease, dilated cardiomyopathy, heartworm, bacterial pneumonia, and also heat stroke. Next, so the diagnostic workup done. Bentar ya. Okay, the diagnostic workup done is a radiograph. We took the right lateral view and as well ventral dorsal view. So here we have the okay. Okay, so we have the right lateral view. Here we have we did the VHS scoring, in which the counted score was, the measured score was about 12.6, in which the normal maximum score would be 9.5. So you can see that the heart is enlarged prominently. So from the yellow arrow, you can see the heart appears enlarged and dilated. Blue arrow shows a presence of bronchointerstitial pattern within the lungs. Pink arrow shows that the liver appears enlarged, as you can see. And the purple arrow shows the stomach, which is distended with, maaf, disconnected. Yeah, we present there also. Present situ aja. Oh, betul. Dah. Yes, access. Dah.
Disconnected.
Iya. Boleh. Boleh. Okay. 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 Okay, ini diulang kembali ya. The first radiograph, which is the right lateral view, the VHS score is 12.6, which is quite high, which the normal maximum amount would be 9.5. So it shows that the heart appears the heart is very much enlarged. And the yellow arrow also indicates the same, which is the heart appears enlarged and dilated. The blue arrow shows that there's presence of bronchointerstitial pattern within the lungs. For the pink arrow, it shows that the liver is enlarged, as you can see. And the purple arrow shows the stomach, which is distended with gas, and the since there's enlargement of the liver and as well there's distended stomach filled with gas, the intestine within the abdominal cavity are actually pushed caudally within the abdominal cavity. So the radiographic diagnosis for this radiograph is cardiomegaly, hypertrophic cardiomyopathy, pneumonia, pulmonary edema, and hepatomegaly. Okay, so here's the ventral dorsal view. We can see similar findings. And the radiological diagnosis is also the same: cardiomegaly, hypertrophic cardiomyopathy, pneumonia, and pulmonary edema. Next. Okay, so from the problem list, we can't actually rule out a lot of the differentials because technically all the heart diseases listed mostly can be observed through the enlargement of the heart itself, but we can rule out heartworm because we are unable to observe any presence of parasites within the radiograph. And bacterial pneumonia, we can't actually rule out because we haven't performed some sort of complete blood count to observe the amount of white blood cell. And also we did not perform any bacterial culture. And heat stroke could be a possibility due to the environment and could also contribute to the rapid breathing as well. Next. So for now, my tentative diagnosis is suspected hypertrophic cardiomyopathy concurrent with heat stroke. This is because the beagle breed is actually very prone to having heart disease as well. And since the owner said that the labored breathing has been present for quite a while, it's just that after the owner left the animal alone in the household for like quite some time, the animal is put under stress, which much more contributes to the condition that she's having now. And we believe, I believe that it is also undergoing heat stroke as well due to the environment, and also contributes to the shallow rapid breathing and how the condition develops. So yeah, so I believe it will be concurrent with the heat stroke. Next. So the prognosis is guarded because when Panda came to the hospital, it was already an emergency case, and we can't perform any sorts of PE, detailed PE. We have been consistently providing oxygen supplementation to Panda, because if we were to leave it be even for a few seconds, it will become cyanotic, and much worse cases could occur if left unattended and unattended. And also for these cases like this, in which the animal is already having severe heart problems and as well as severe respiratory problems, what we can only do is just provide supportive treatment in order to stabilize, but not actually fully treat whatever the disease that their patient's having. Next. Okay, so here we have the treatment plan. So for furosemide, aspartate, digoxin, and as well as captopril, they were given in a pill capsule. So they were mixed. So they were given twice a day for 10 days. So there's about 20 capsules, yes. And as well, we're given ampicillin for as antibacterial. And when we attended Panda, Panda was given oxygen gas supplementation. I was placed in the nebulized chamber, in which we use Ventolin, Bromhexin, and sterile water. Next. Okay, so for suggested diagnostic workup, we can perform ultrasonography. This is to actually observe the dilatation or the thickness of the heart walls in order to determine if it's a dilated cardiomyopathy or hypertrophic cardiomyopathy, or if it's like a mitral valve disease. So we can observe much more in detail with ultrasonography. We can also perform complete blood count in order to determine if it's an infectious case or is it a non-infectious case, and also perform bacterial culture. Next. Yeah. So for contraindication is the owner must comply to the treatment plan provided, minimize any stress upon the animal, as the animal is already in a very bad condition, and closely monitor the condition of the animal. Immediately bring to the nearest clinic hospital if emergency signs are detected. Assist the animal in exercising adequately based on the animal's capability, but not forcefully force the animal to exercise itself. Next. And for update, Panda actually passed away on the same day itself at 9 PM in Rumah Sakit Hewan Ipebet. Yeah, and that's all. Thank you. Enggak, mati. Mati. Passed away.
Oh, tadi saya.
Iya, passed away.
Berapa lama passed away?
Jam 9 hari sama. Jadi ya hari samanya diletak di chamber, bagi oksigen sama nebulizer. Langsung dimonitor aja. Dimonitor langsung jam 9 itu lah makin teruk. Terus langsung hypoxia langsung mati. Jadi because we believe that the animal is already suffering from already heart disease. So from discussing with Dr. Nana dan Dr. Rudy juga, katanya possibility there's a concurrent with heat stroke as well because waktu itu panas. So, yeah, jadi can contribute to the hypertension. Animals lagi stres lagi mau bernafas.
Nanti saya sebentar dulu dari dan nggak apa-apa
Iya, langsung di chamber mau harus dibagi oksigen. Iya, aminafilin.
Oh, dia pasien dari pas datang pindahnya tiba-tiba
itu langsung hypoxia, harus datang terus dibagi oksigen.
Oh.
Ya itu langsung lepas aja 5 detik 10 detik itu langsung biru. Ya, biru lagi harus. Ya. Ya. Ya.
Oke, kita lihat Mas.
Dipilih. Personal.
Itu membaik setelah itu. Ya. Oke.
Sepanjang banget, sepanjang di RSHP juga bagusnya tuh.
Ini berarti dia kalau dikasih resiko nggak terlalu baik, nggak jadi, sudah nanti mau
Sampai
nggak ada. Oh, ini video.
Ini bisa jadi congenital nggak? Ya, kasusnya. Boleh jadi congenital.
Enggak, kalau 7 tahun kan. Ini kalau HCM, kemudian MOHD, mungkin kalau mau MOHD di atas karena mungkin 70%.
Ya, itu common.
Disease is MOHD. HCM bisa jalan. Kalau mau MOHD.
Oke. Jadi tentatifnya MOHD.
Ya, lebih banyak kucing.
Ya.
Terus itu oke, karena kan kalian tidak melakukan
ultrasound ya.
Jadi tidak tahu pokoknya dia sampai langsung. Kalau saran saya, kalian tulisnya nomor 1 differential diagnosis, because if we put the differential diagnosis itu kan based on the jadi menurut saya nomor 1 differential disebabkan oleh mungkin disebabkan oleh kan yang kita lihat kan berdasarkan dari ya ini kan dari radiografi ya. Iya. Mungkin itu aja yang satu oke. Terus kontrol ya ada yang lagi. Iya. Itu ada 11. Ada penekanan juga ke paket. Ya ada. Paketnya kelihatan itu. Dari itu ke the tracker should be in line with the spine, the thoracal spine. Itu atas ya. Tidak in line kan? Iya. Jadi ada. Nah sebetulnya kalau di sini kalau mau radiografik diagnosisnya, radiografik diagnosis kalian sebetulnya tidak boleh. Because if you write HCM, then you see the muscle thickness. Iya benar. Itu disebutnya enlargement. But which part? Mungkin bisa kalian sebut yang sebelah mana? Left side or right side? Left side. So better to put better. You should put cardiac enlargement on the left sided heart enlargement. Jadi jangan tulis HCM. Jadi kalau sudah perform ultrasound dari HCM. Oke, nomornya oke lah kan, tuliskan. Ada juga spesifikasinya. Tapi kalau kalian based on the presence of the nomornya. But you have another harusnya di dalam situ apa lagi bisa menyebabkan bronchointerstitial. Umurnya udah tua, jadi mineralized sebagai apa? Macam buku. Oh itu kan dari bronchitis kan? Itu ada bronchitis. Tapi ada lagi apa lagi? Jangan lupa mungkin tumor. Ini kan kalau bronchial pattern should be pasti related to the respiratory tract. But if you put interstitial pattern should be not related to the bronchial, right? In the interstitium. But if you put bronchointerstitial between, artinya ada kelainan di bronchus tapi di interstitial juga ada. Jadi kalau kamu nulis di sini bronchointerstitial, should be disease ada pneumonia tapi interstitial pattern itu mungkin karena inflasi pulmonary edema, terus tadi apa? Mineral kayak jadi kamu warna kan sesak napas itu. Ada tumor di situ. Kamu lihat livernya besar kan? Iya, besar. Mungkin nggak livernya besar. Mungkin juga. Mungkin kan? Iya kan? Jadi radiografik diagnosisnya harus karena yang menggali ini. Dan itu HCM, nomornya oke, terus ada tambahan tadi kan? Iya. Kalau di atas ada distended stomach field gas, di radiographic diagnosis itu kamu harus tulis juga. Jadi kalau you put finding here, so you should be summarize here, ya kan? Ini kan di sini kamu tulis distended stomach field gas, tapi di sini kan ada. Di sini kan harus ditulis juga.
Jadi because this diagnosis is based on this finding. Terus next lagi. Ini sama ya?
Iya.
Oke. Diferensialis di atas sebaiknya aja ya. HCM boleh tapi jangan ditulis di situ ya. Jadi dia dalam gulungan ya kamu tulisnya kalian yang lain dan saya tetapkan baik-baik.
Kalau congested heart failure.
Boleh aja. Kamu sebutnya apa? Congested heart failure.
Congested heart failure. Congested heart failure.
Kalau kemudian kita tahu bahwa itu bakteri pneumonia dari mana kan? Jadi cukup tulis. Ini boleh lah ya. Ini kan spekternya aja. Tapi spekternya mungkin kalau paling utama yang di ya. Kalau kucing HCM. Oke, kemudian obat-obatnya. Kakak tahu ya? Oke, nah, udah berapa?
Lagi 2 orang.
Ya udah baru. Ada kopinya di kos. Ada di IC ada. Di rumah.
Okay, so next is Nurin. Okay, silakan Nurin.
Moving on to patients in home. So this patient is this disease behind his age is 1.5 years old. Body condition score is 2.5 out of 5. Human head weight is 3.42 grams. Vaccination and illnesses due to system. And the medication is outbroken. As for the client complaint, Una owner complained that Una has been very negligent and has difficulty in breathing. Some history. On 24
August 2022, Una's owner noticed that Una has suddenly become weak, inappetent, and has abdominal breathing. And then on the next day, on 22 August 2022, Una was brought to RSHP IPB and was given medications such as theophylline, furosemide, vitamin E, vitamin B-Plex, and HP Pro. However, after 3 days after that, Una was brought again to RSHP IPB due to her breathing had become worsened and there were no signs of improvement. To add on, Una's owner had been having difficulty in giving Una medication pre-oral. Okay, so based on our physical examination on 25th June, so based on the temperament, Una appeared to be dull, weak, and not responsive. The vital signs for Una, the temperature is normal, 37 point, not normal, hypothermia, 37.4, and the heart rate is tachycardia, 248 beats per minute. And for the respiratory rate, Una also has tachypnea, 84 beats per minute. For dehydration test, Una It's euhydrated, it's less than 5%. The mucous membrane color is still pink. The CRT is less than 2 seconds. There's, as for the physical examination of the respiratory system, Una was observed to have open mouth breathing and abdominal breathing. So this is the video. Sorry. This is the video. Okay. As you can see from this video, Una had abdominal breathing very rapidly. Take it now. Okay. So moving on to the diagnostic workup. So the diagnostic workup done here was our radiograph. So based on the problem list, which is open mouth breathing and abdominal breathing, my differential diagnosis was viral pneumonia, bacterial pneumonia, which can cause by Bordetella bronchoseptica, common one. And then another one is pleural effusion, such as hydrothorax, pneumothorax, pneumothorax, and also pneumothorax, hydropericardium, diaphragmatic hernia, peritoneal pericardial diaphragmatic hernia, PPDH. Okay, next. So, so this is the ventrodorsal view of the chest cavity. So based on the clock analogy, the findings were the heart appears rounded, as you can see from 12 to 3, 3 to 6, 6 to 9, 9 to 12. The heart, all chambers of the heart appears rounded. So, so this is also the ventrodorsal view of the Una's radiograph. So from the findings here, as you can see on the red circle, there's radiolucent structure within the pleural space. And also, as you can see on the blue arrow, there's increase in the radiolucency of the structure surrounding the heart. And as though for the purple arrow, all 4 chambers of heart appears enlarged. So my radiological diagnosis would be pleural effusion, hydropericardium, and cardiomegaly. So this is the left lateral view of Una's radiograph. As you can see here on the red arrow, there's increase in sternal contact, which is more than 2.5. And also there's tracheal elevation, as you can see in the yellow arrow. And then for the purple arrow, you can see there's discontinuation of the diaphragm. There's a curvilinear soft tissue density between the cauda aspect of the cardiac silhouette and the diaphragm. So my radiological diagnosis would be cardiomegaly, hydropericardium, and pleural effusion. And this is the VHS score for the left lateral view of the Una's radiograph. So the VHS score is 13.8 vertebrae, which is very big because normal range in cat is 6.8 to 8.1 P. So my interpretation is there's cardiac enlargement. So this is my new differential diagnosis post-radiograph. So since there's cardiomegaly, my top list in differential diagnosis is hypertrophic cardiomyopathy due to the high incidence rate in cats, hydropericardium, dilated cardiomyopathy, and chronic valvular heart disease. So, so this is my differential diagnosis overall. So I cannot fully rule out viral pneumonia, bacterial pneumonia because we did not experience any pleural fluids. And as for the pleural effusion, as I stated before, no thoracosynthesis was done. We cannot identify whether it's hydrothorax, pneumothorax, or hemothorax, but there is pleural effusion based on radiograph. And pneumothorax and diaphragmatic, pneumothorax was ruled out because based on the radiograph just now, the lung fields are very clear and there were no abnormalities. And as for the diaphragmatic hernia, it was ruled out due to, there was no hernia observed, but PPDH was not ruled out because based on the radiograph just now, as you can observe, their caudal aspect of the pericardium come in contact with the border of the liver. So there's hernia, but PPDH. And usually PDH is accompanied by cardiac enlargement. That's why I cannot rule out PPDH. Okay, and then for the cardiomegaly, my top list is hydropericardium, hypertrophic cardiomyopathy, as that was my top list. However, for dilated cardiomyopathy and chronic valvular heart disease cannot also be ruled out, because in conclusion, HCM, DCM, VHD can only be confirmed by ultrasonography. As for tentative diagnosis, is hydropericardium due to suspected hypertrophic cardiomyopathy with pleural effusion. So the prognosis for Una is poor, because despite given medication, Una show no signs of improvement, and her vital parameters are not within normal range. So for the treatment, this is treatment for 25th June. Okay. So the drug given was aminophylline. It acts as a bronchodilator. Dosage was 5 mg per kg. The dose is 0.8 ml. Frequency is BID. Duration is for 10 days, and the route is PO. Furosemide is also given. Sorry, it's not osmotic diuretics. It's actually a loop diuretics. The dosage is 4 mg per kg. Dose is 1 ml. BID for 10 days. Pre-oral. Fluid therapy was also given to Una. During the treatment, she was given lateral solution. So for the future plan is ultrasonography, because we want to know the condition of Una's heart. And then my suggestive diagnostic workup is aspiration of pericardial fluid through pericardiosynthesis, ultrasound guided, and then trachosynthesis, because we want to know what was the content of the pleural effusion, and then complete blood count, CBC. Because we want to know if what was the main cause of the hydropericardium. My client indication is only supportive treatment can be provided to Una, and Una requires attentive monitoring due to her condition. And as for patient update, on 28 August, which is 3 days after that, Una died at 1 p.m. So credits to my supervisor, paramedics, administrator of my friends and class. Thank you.
Jadi tadi cara menuliskan aslinya sudah lebih terpatengin ya. Kalian bisa lihat saya pakai elemen baru begitu apa. Menurut saya sih kita isinya kucingnya mungkin nggak di ultrasound. Sebenarnya kalau kemungkinan sih ini efisi perikardi.
Efisi perikardi. Good question.
Soalnya bentuknya round. Kalau bentuknya round, simetrikal, lain biasanya fluid. Kalau HCM itu mulai mungkin combine fluid with HCM, jadi dua-duanya dari HCM terus oke. Itu udah oke tadi. Oke. Ya.
Cuma saya tidak pasti kalau
HCM tidak menggunakan nah tadi dari kali effusion menyebabkan HCM-nya bikin oke, ada di next.
Ini.
Oh, saya itu salah susun. Astagfirullah.
Ada terjemahan jelasan. Oke, teks berikutnya.
Tidak kenal loading dok. Atau mau lihat dari presentasi? Oh, udah.
Nah, terus next lagi.
Ini ya, Mbak. Yang ini video ada mobil dan menurutnya sebenarnya itu lagi
Tapi dia mungkin juga memang mengenal ATM ya.
terus ini saya kerja.
Oh iya. Mungkin yang harus itu hidroferik tidak ada ya. Oke. Kalau pusing bisa itu Io, hemotorak. Ada satu lagi kilotorak.
Oh iya, Kylo ya.
Dari ini. Ini.
Ini
focusing on the thoracic radiography aja.
Iya, oke. Ya sebenarnya.
Tapi mungkin kamu masukkan juga yang abdominal. Ya.
Iya.
Karena abdominal kan ini lipat yang lagi. Itu sudah kini.
Ya. Ini.
Ini yang lain kan?
Banget.
Kamu tuh calculate ini survey ini.
Ini kan dia kena 2 point.
Dia kena 2 point.
Dia defense ini.
Kalau ada dua kategori yang mana?
L2. Oh, L2. L2. Oh, sorry about that.
Ini tadi.
Cuma kalau gitu ini ada discontinuation of the license. Soalnya itu dengan border.
Iya. Mungkin discontinue karena.
Oh, oke.
Boleh aja bilang discontinue. Tapi maybe cost by real discontinue dan nanti cost for import gitu.
Bukan.
Mungkin aja tuh boleh dituliskan. Kamu di differential Indonesia kan? Boleh pamit, harus mendengarkan juga.
Ya, jelas presenter.
I use my own Wi-Fi. This one up here. This one. Okay, so I'll be presenting on oral tumor in 3 years old domestic short hair cats. So the client complaint is Oyen has masses in the ear, on the right ear. And based on history, on 29th of 7 to 2022, Oyen visited RSHP because the owner found that Oyen has masses in his ear on the right side. And on the first 8th of 2022, Oyen visited again RSHP to perform the blood test to prepare for the surgery operation. And the 18th of 8th of 2022, Oyen visited RSHP for mass removal. For the patient signalement, the patient ID is Oyen, which is a feline domestic short hair with 3 years old male with body condition of 3 out of 5 based on Royal Canin. And the weight is 4.3 kilogram, and vaccination and deworming status is not in the list, and the management is outdoor. So for the physical examination is the Oyen's temperament is bright, alert, and responsive. The vital sign for the temperature is 38.2, which is within a normal range. And for the pulse rate is 156, which is having a tachypnea. And for the respiratory rate is 28 beats per minute, which is in a normal range. For the mucous membrane, it is P with a capillary refill time is not more than 2 seconds. For the integumentary, it is having a multifocal alopecia at the head and the neck region. And also have crusty skin lesions on the neck region. For the ear, it has a crusty ear on both sides and having a hemorrhagic and cauliflower-like structure within the ear canal on the right side. So for the differential diagnosis for the problem list for multifocal alopecia and crusted skin, I rule in scabies, flea bites, and dermatitis. For the problem list for crusty ear pinnate, I rule in ear mites. And for problem list of hemorrhage and cauliflower-like structure at external part of the ear canal, I rule in auricular polyps, sebaceous adenoma, squamous cell carcinoma, ceruminous gland adenocarcinomas. And I was not able to rule out any of these because the histopathology result is still pending. And for the next diagnostic workup that has been done is CBC. It is complete blood count, serum biochemistry, surgical intervention. For the serum for the complete blood count, based on hemorrhage, we can see here is on the platelets of thrombocytes, MPV and PCT is Oyen is having thrombocytopenia. And for the leukocyte, it is high compared to the normal level. So Oyen is having a leukocytosis. For the granulocytes, it's also high, indicate that Oyen is having granulocytosis. For the serum biochemistry, here we can see that the ALT level is high. It can be indicate that the Oyen is having liver damage because there's a probability that Oyen's liver has been damaged because the release of alanine into the blood circulation. And the biochemistry of a total protein is also high, can indicate a chronic infection. So for the surgical intervention is having Oyen undergoes tumor removal with cauterization. So for the anesthetic protocols for the pre-operative medication, it's the drug that has been administered is atropine with dosage 0.025 mg per kg, which is dose given is 0.43 ml, and the routes given is subcutaneous, and indication this is for pre-med. For the drugs of ketamine, is dosage is 5 mg per kg, dose given is 0.0 ml, route through intravenous and induction. Same goes to azithromycin, given a dose of 0.75 mg per kg. And the dose given is 0.2 ml, route intravenous, and also for induction. For the post-op medication, the drug that is administered is Hematidine, which is 0.1 milli, and then the dose given is 0.43 millimeter, and the rate given is intramuscular, and indication is hematopoietic. And the drugs provided is dosage with 0.1 ml, dosage given is 0.46 ml, and the routes given is intramuscular, is indication for muscle contraction and also to boost the immunity. This is the procedure that the ON had to go, which is oral tumor removal with cauterization. So for the first step, it is the ear was positioned and the inner ear pinna was flapped to the outside to expose the mass. And the second is by using a thumb forceps, the mass was lifted, and then the mass was then be cauterized by thermocautery, and the bleeding was stopped and cleaned with and also dabbed with cotton pad. And next step is the remaining tumor were cauterized. So, and then next is, because there's like every time when the tumor has been cauterized, it can cause bleeding. So the surgical site will be pressed with a gauze pad to ensure that there is no hemorrhage before the surgery ended. And the ear canal were inspected thoroughly to ensure there are no leftover mass to avoid regrowth of the mass. And at the end of the procedure, the agatist, which is the topical medication, were being applied at the surgical site as anti-inflammatory. So my tentative diagnosis is oral tumor, and the prognosis is good because ON really respond to the medication, and all the vital parameters is within a normal range. So here is the treatment plan. That is medication that is for take-home medications. The medication given is amoxicillin with clavulanic acid, meloxicam, vitamin B complex, and also aminos. So for the client education, it is to ensure that the client ensure that all medications given to be complied, especially antibiotic, to evade any kind of antibiotic resistance, and also to monitor the surgical area, put the Elizabeth collar on the ON to ensure that the ON will not scratch the ear, and to also avoid a trauma, and also revisit for alopecia treatments. That's all from my slide. Thank you.
Okay, thank you, FAQIHAH. Saya prognosis itu selalu setelah treatment. Prognosisnya selalu after treatment. Mana prognosis itu prior to treatment. Before treatment, kan? Before surgery first and the last is prognosis. Oh, salah susun. Oke. Ada studi prognosis first kan ya, and then baru ada treatmentnya macam-mana.
Nggak bisa di rule out soalnya nggak ada stop.
Nggak ada stop.
Maksudnya lagi pending.
Oh, iya. Dikirim ke
tapi lama kali ya. Sekarang sudah September.
Siapa tahunya tuh PSSK?
Kalau belum dikirim ke Pak Kiki, katanya nanti dikirim ke dosen, mungkin yang bisa kan menurut Mas.
Kirimnya kapan?
Hari Jumat 2 minggu yang lalu. Iya.
Gini, any question?
So for the treatment plan, like medications for, sorry, I want to ask a question. So the medications given is already like amoxicillin. So kenapa dikasih lagi amoxicillin?
Mungkin artinya beda. Bisa di 3 days first.
Artinya beda ya?
Kalau dibagi saja atau berbeda.
Sempat infeksi, terus diganti dengan
di top up ya? Top up lagi.
Nanti dia lalu dilanjutin dari keempat sampai
jadi masih 3 hari itu masih kita ada kelas di top up dengan asam kelasnya amoksiklap.
dua-duanya bersama.
Mungkin ada after kali ya. After first treatment. Dari kelas ada question suggestion teman-teman? Bahasa boleh?
Kasusnya Prof.
Kenapa?
Ini kasusnya Prof. Gitu ya. Jadi kita udah lihat yang bahas teori sih mungkin dari kalau misalnya nih udah pernah buat kasus-kasus juga.
Itu histopatnya belum?
Tinggal histopatnya yang menyusun karena miskalkulasi dari kita kira kan histopatnya bakal cepet dok. Ternyata histopatnya buat ngasih sampelnya aja butuh waktu hampir seminggu.
Masih sampelnya?
Ngasih sampelnya karena dilempar suruh ke sini, suruh ke sini.
Oke.
Terus katanya nanti mau sama Prof mau jadi artikel.
Oke.
Buat presentasinya berapa?
Gila presentasi. Minggu ini ujian kan ya?
Iya.
Ada jawab kerja?
Apa ya dok? Mungkin ini tidak hanya untuk OIN ya. Mungkin nanti kalau misalnya kalian dapat cases dan kalian ada yang ada dugaan tumor dan takutnya tumor itu misalnya malignan gitu kan, kita harus biopsi untuk kita tahu ya. Nah setelah itu misalnya menunggu nih hasilnya, kalian juga bisa doing aparat radiologi untuk make sure apakah tumor ini itu metastasis atau tidak. Karena kalau dia metastasis dan metastasisnya itu sudah terlambat orang, sudah ke paru gitu maksudnya ya, itu berarti prognosisnya akan menjadi reduce in hosta karena kalau sudah di paru kan tidak belum ada ya teknologi untuk diambil paru dan transplantasi gitu. Sampainya gitu.
Oke, terima kasih. Belum di round sama gini kan? X-ray? Oh, sudah buka. Oke. Baik, mungkin Prof. ini?
Kalau lihat, coba dari pertama Lisa. Oke, slide berikutnya. Oke. Mungkin mundur tadi dulu. Harus jelas dia left or right. Ya, ada dua. Ini juga semua harus ada left or right-nya ya. Oke. Oke, next. Jenisnya, Oke,
ini ada, tapi biarnya pasien beda. Kok
next.
dokter itu? Iya, bukannya dari dokter sih. Mencatatkan pasien mau ditagi, kita ngomong dokter saja.
Mungkin kalau ALT yang lain bukan hanya per daily, tapi juga kesilian ditambahkan dari ya. Walaupun biasanya kalau di hari ALT juga naik, tapi mungkin saja kalau dari request baru ALT.
Tapi induction dua-duanya. Ketahuan RSHP buat is induction.
Ini maju. Oke. Ini operasinya siapa? Oke.
Oke, nah terima kasih alhamdulillah. Mbak, di sini ada siapa? Tengok audiensnya. So, siapa aja? Nggak ada. Oke. Oke, I think enough ya. But some part is need to improve ya. Nanti boleh masuk balik ke sana, boleh discuss dengan sana. Sini juga kita keep contact with something. Need to apa? Mungkin ada data yang tadi nunggu itu kan. It's about maybe next month sudah ada gitu ya. Jadi boleh di compile ke complete paper. Jadi dalam masa balik nanti saya sudah share jurnal ya, template, jadi very short paper ya, very simple. I think it's enough for your report test study. Not only as conference ya, kalau rasanya outputnya apa?
Clinical conference.
Yes, apa ada proceeding kah, atau ada jurnal atau
Cuma buat
terus ya. Yes. So supaya nanti ada apa ya, prasasti ya, dapat tilas from Indonesia. We have joint paper gitu ya, from this from the IPP and UMC. Nanti boleh kalau sudah publish boleh letak dia punya kurikulum vitae dan paper publish from macam itu ya. Jadi itu saya kira. So dalam hari ini bila apa-apa ada yang kurang atau apa yang perlu segera ya dikomunikasikan, komunikatif bisa tahu mana boleh ya. Mereka sudah boleh sana nanti boleh lagi nak dua itu ya. Jadi mumpung masih di sini, jadi esok the last day ya, because we have schedule for dua mobil ya, maybe midnight from Amarillis, flightnya jam 5. Subuh bro. Jam 5 subuh.
Mas. Mas mahal ya?
Iya.
Kalau RSHP, KL ke Kota Baru.
Yang lain di sana.
Oh, ini di Selama Kota dulu.
Oke, baik. Maybe ada yang disampaikan closing statement from saya. Baik, Alhamdulillah, terima kasih for your time and participation ya for this report and report presentation for industrial practice ya in ITB. Biasanya originally for each internship should be present their activity and apa yang sudah dapat. Saya kira cukup. Mohon maaf for any yang aspek kalian yang belum komplit dan kekurangan. Waktu dulu. Selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih Prof. Benny sudah waktunya. Oh, take a picture.
Oh ini.
Oh ya, for di sini terima kasih yang hadir di online sudah berkata. Anak-anak magang PKL.
Kalian kalau makan apa?